Well, the Supreme Court this week, they left the healthcare reform law uncertain. You know, right now they say that the average cost to cover the typical family of four is up 7%. It's at about $20,000 right now under an employer. But you know, when I read that, I say to myself, under an employer. So these are people that are working. And once again, we always see these issues in the news. You know, we're not looking at the freeloaders. We're talking about the people, the average people of four, who are getting up, mom and dad or whatever, going to work every day, doing what they're supposed to be doing. And these, once again, are the people who are going to be hit the hardest with these things. These are the people who are causing this news, causing the chaos, so-called. But we're not talking about the people who are getting it for free on the taxpayers' dime. So it's kind of like a double hit. Not only are you taking out the taxes out of my paycheck to pay for some of the freeloaders, and I say that because there are a lot of them. Okay, there are people who do need the system. I understand that. But we're talking about some of the freeloaders that our state officials know exactly who, where they are, or whatever the point may be is. So the hardworking taxpaying citizens getting taxes taken out to pay for their medical, and then their employers taking a little bit more out of their paychecks also because the rising medical costs are going up, so they need help a little bit more. I just don't understand it. And they say that while employers still shoulder the majority of the health care expenses, well, we're shoveling out so much more money to pay for not only our freeloaders, but other countries. You know, that's another thing that bothers me. Sometimes we might have that poor incident or whatever from another country. Boy, our doctors will do a free surgery in a heartbeat for something like that. And then, you know, we see these things in the news. You know, it's the bottom line is freeloaders should not burden the rest of us. Okay? The bottom line is the system is broken. We're not going to fix it. You know, you could have the Obama plan called the Affordable Care Act. We've had these guys in office talk about all these acts. Nothing's working. Nothing's going to work. And for the simple reason is it's all talk. There's no plan of getting anything together. The bottom line, it's broken. You really need to have somebody sit down, tear the system completely down, and build it all over again because it's broke. Okay? It's never going to be fixed. I don't really think people want it to get fixed. And when I say people, I'm not talking about the tax-paying citizens. I'm talking about the politics. I personally think that they have a plan, and I've said this before, they have a plan, and it's not the way we want to see it going. It's definitely going in a wrong downhill direction. But the health care plan is crippled. It's broken. You know, so a lot of these people, you know, nowadays, you know, like I don't want to say that we're carrying the burden for them, but a lot of the freeloaders, not only are they, you know, taking up a lot of the expenses in our health care, but they're also using emergency rooms as their primary care outlets. I mean, you know, you go there all the time, and you don't need to have a primary care doctor. You got the emergency room down the street. We have some serious problems in this country, and we've had them for a long time. I mean, I could continue to stress out a date. I mean, I think since 2001, this is just my personal opinion, everything has gone downhill. I mean, we've definitely forgotten about the American way and the American dream. It's just totally turned around. But this healthcare, it's not going to be fixed. We've got so many people paying into it, and so many people not paying into it, but using everything. I don't know if it's because some of the people have, you know, 11 kids and 6 of them get sick and they got to take the whole family in there, but it's not going to get fixed until we start with that group first, who aren't putting into it, okay? Most of the people on my street, they're going to, well, all of them going to get up, go to work tomorrow, do what you got to do, and they're going to pay into the system. But for the 64 houses in my neighborhood, there's 64 people going to work. There's 139 not going to work who are going to go down the street to get on the system and get it for free. So until we fix that gap, it's never going to get fixed. Never going to get fixed. For every 2 people going to work tomorrow, there's 2,000 going to apply to become freeloaders. We're never going to fix it until we fix that problem first. That's the bottom line, and that's the cause of a lot of problems. That's what you need to do. These are no-brainers. I didn't go to college. I got a high school education. It doesn't take a rocket scientist to figure that out. My God, folks! Thank you. Have a good day.